Bismillahirrahmanirrahim. Moving on to the part 2, the vestibular system. The vestibular system is responsible for body's equilibrium. It maintains balance and it provides awareness of body's spatial orientation. Other than this, vestibular sensory organs detects changes in the head positions and movement, and it stabilizes the gaze during head movement. Vestibular system transmit this information to the various regions of the brain. The projection to the different regions of the central nervous system include projection to the cortex, which provides the perception of gravity and the movement. Projection to the cerebellum helps us in coordination and smooth movement of the body, while projection to the brain stem and the spinal cord trigger different reflex pathways that lead to the compensatory actions to maintain the stability or to reestablish the equilibrium. Examples of such vestibular reflex pathways include the vestibulo-ocular reflex that stabilizes the gaze during head movement by controlling the extraocular muscles. It does so by moving the eyes in the opposite direction of the head. The other vestibular reflex pathway include vestibulospinal reflex that senses a potential loss of balance and activates the extensor muscles of the body to keep the body from falling. The sensory components of the vestibular system include three semicircular canals and two otolithic organs. They contain specialized or receptors. Semicircular canals contain receptors crista ampullaris that respond to head rotation, and the otolithic organs contain macula that respond to linear and linear acceleration and a head tilt, such as it sets signals about head position as well as straight line motion, such as when riding a car or an elevator. The three semicircular canals or ducts are oriented approximately at right angle to each other. Each corresponds roughly to the three planes of motions. Superior, when we nod our head up and down. Horizontal, when we say no, yeah, right to left, and posterior when we turn our head to a side. Each canal has an enlargement at one end, and this is known as ampulla. Within the ampulla, there are hair cells which are embedded in a gel-like structure called copula. When the head turns, the ducts that are located at the same plane also rotates, but the foot lags behind due to inertia that causes either push or pull on the copula, bending the cilia of the hair cell. This activates then and sends the signals to the brain. The direction of the bend determines whether the signals are excitatory or inhibitory. Because the two sides of the head are mirror images to each other, head tilt to the one side can cause excitatory signal at the one side or inhibitory signal on the other sides. Two otolithic organs are two patches of hair cells that are perpendicular to each other, the saccule being vertical and the utricle being horizontal. The cilia of these cells are embedded in a gel-like substance sprinkled with a calcium carbonate crystals called otoconia. These crystals add weightage to the layer and pull it down when with gravity. When the head is in upright position, the gelatinous material bears down evenly on the surface of the utricle. Thus, the cilia remains straight and no signals are generated in the utricle. While in the s- while in the saccule, while in the saccule, the there is a bending of there is a bearing down of the loose gelatinous material due to gravity, and there's a pulling of the cilia of the hair cells and causes the activation of the hair cells and generation of signals. Other head positions are determined by the combination of the signals. The vestibular sensory organs detect not only the motion itself, but it also detects the changes in the rate of motion, especially acceleration and deceleration. For example, when a person is sitting in a car that starts to move, the heavy gel-like material lags behind due to inertia, but causes the bending of the cilia back, activating the hair cells. The more sudden the car starts, the greater the stimulation. Once the car is in stable motion, the gel catches up with the rest of the body, and no activation generates. Similar action occurs in the saccule during an elevator ride up and down. Vestibular system dysfunction can make it impossible to stabilize an image on our moving retina, and it causes the feeling that the world is uncontrollably moving around. This feeling is known as vertigo. Walking and standing can be difficult or impossible. Such diseases include Meniere's disease, labyrinthitis, and benign positional vertigo. Thank you for watching. This is a reference